All right, so I'm just recording 13 minutes for us here. Here we go. My name is Mike Corman. I'm an assistant professor of sociology at the University of the Fraser Valley.
Hi, I'm Michelle. I'm the research assistant on this project, and I am also at the University of the Fraser Valley. So really quick, just to talk about, why study paramedics and why now. So paramedics are a relatively new health and social care profession. They're established in North America in the 1960s. In the past, paramedics didn't really have medical training. They were more focused on just transporting patients to the hospital rather than providing medical interventions. Whereas now, today, paramedics are trained to use specialized medical knowledge and a variety of medical procedures and interventions to treat patients on and off the streets. In Canada alone, the number of paramedics exceeds 30,000, making them one of the largest healthcare providers in the country. And in the United States, where some of you are, this number is more than 250,000. So paramedics in the 21st century are considered central to the provision of healthcare in North America, as well as other developed and developing countries around the world.
So when we think about paramedics and sociology, we know that despite the growth in the profession, the work of paramedics has essentially been taken for granted. There has been very little sociological attention, geared towards exploring EMS as a profession and a social organization. Part of this research was done in my book, Paramedics on and Off the Streets, whereby I explored the complex work paramedics do, both on the streets and in hospitals and other settings, and how their work interfaces with other practitioners, patients, technologies, etc. This research led to different publications that focus on, for example, how paramedics, quote unquote, titrate their rigs, the street medicine work the paramedics do, and even their driving to work, how they drive to and from the scene. But more recently, I've become interested, and we've become interested in the education and training of paramedics. With my colleagues in the UK, in Northern Ireland, with Dr. Grania Kearney and Jerry Gormley, we're really interested in some of the focus on the exploring health professions education from the context of different professions, for example, medicine. But here we are really interested in exploring health professions education from the context of EMS, right? In a sense, my previous research really drew attention to some of the tensions that emerged in the training and education of paramedic. We have a comment here on the slide that says there appears to be a disjuncture of sorts for paramedic students, whereby their training doesn't actually reflect what they do in practice. So suffice to say that health professions education has really kind of moved towards this sort of the standardized competency-based approach that focuses on measurable outcomes, where students must demonstrate what they have learned in very quantitative, standardized, text-mediated ways. Of course, how is this problematic? Right? As we're going to introduce shortly, we see many tensions in how EMS is organized in Canada and likely elsewhere.
All right, so the study we're working on is the next step in researching the social organization of emergency medical services from the standpoint of paramedics. So the purpose of this study is to explore how the work of becoming a paramedic is socially organized. And the following research questions will be explored. So first of all, what is the work that goes into becoming a paramedic? What are the key discourses organizing what paramedics are taught? And how are key competencies taught and certified in the educational setting? And by answering these questions, we seek to better understand the social organization of health profession education in the context of emergency medical service providers. This work is important as there's been no research to date that chronicles the work of becoming a paramedic and how that work is socially organized. And hence the education and training of paramedics is ripe for sociological investigation.
So this is a slide that I'm most worried about because this is about a 15-minute slide, and I have about a minute to go over this. So forgive me, please, if there's something that I'm missing out or if I go through this a little bit fast. But the study is organized as an institutional ethnography. Institutional ethnography was developed by Dorothy Smith, and it's kind of a sociology geared towards changing the world. Dorothy Smith relies on feminists' underpinnings to do research grounded in people's everyday lives and to challenge mainstream ways, objectivist ways of knowing and doing, right? She describes institutional ethnography as a sociology for people. In order to do so, she relies on ethnomethodological insights proffered by Garfinkel and his desire to provide a sociology that problematizes the subject-object divide and that explores how people's everyday lives are concerted upon. Okay. Smith also relies on Marx, Mead, Volosanov, and Bakhtin to make language and ideology key to IE's, to institutional ethnography's project of discovery. So that's a very high-level overview of IE. Forgive me if there's more depth that you would like, and if so, we're happy to talk about it during the Q&A period. So to date, we've interviewed 9 individuals. The range of interviews is roughly 1 to 2.5 hours. I would say the average interview is about 90 minutes to 100 minutes. We've interviewed 5 students or recent graduates who've gone through EMS training, 3 instructors, and 1 field trainer. A field trainer is somebody who works for a service and trains new recruits, essentially. Due to COVID, we are primarily deploying ethnographic semi-structured interviews to collect data. We are hopeful, however, of the opportunity to do some participant observations as well, which is really how the study was originally designed. Also key to this study is identifying key texts. IE deploys what may be thought of as like a textual analysis to look at how things are organized and put together. And so we are in the process of identifying key texts, like, for example, the National Occupational Competency Profile, different textbooks, different exams, regulations, etc. That was like a minute. That was pretty good.
Yeah, great. So as Mike mentioned, the National Occupational Competency Profile is a document created by the Paramedics Association of Canada, and it outlines 4 levels of paramedics and the scope of their training. So each level of licensing requires a different amount of training, and as the levels increase, paramedics are increasingly trained to provide more medical and pharmaceutical intervention through more advanced competencies. So this document outlines competency checklists that each level must meet. Some examples are, professional responsibilities, communication, health and safety, assessment and diagnostics, therapeutics, and transportation. So a really quick overview here. So EMRs are the most basic level of training. Historically, they've been the first medical responders in rural and remote communities. 1 level up are primary care paramedics. This group constitutes the largest group of paramedics in Canada. And some provinces are actually phasing out the EMR level, so then PCP is the most basic level of paramedic there. Another level up are advanced care paramedics who respond to emergency calls in various environments. And then finally, the critical paramedic is currently the highest level of paramedic certification available. They operate at a very advanced level of specialized emergency care for patients with the greatest need. And again, these levels of paramedic are standardized through that document, the NOCP, which delineates the competencies required for each level of paramedic, as well as the scope of practice they're able to engage in.
Great. So in terms of data analysis, we are really at the beginning phase of this research, but we've done a little bit of analysis for you all today. In terms of institutional ethnography, the goal of IE analysis is to really look at how things are organized, how things work. So how are the experiences of paramedics organized? How are they put together? How are they coordinated by text-mediated social organization? And so the following themes are really emerging themes that we feel are some really interesting points that have emerged thus far in the data that we've collected. So one emerging theme is this notion of paramedicine as a calling, right? The decision to become a paramedic, to go through the training. What we're noticing here is talk is strategically organized from kind of like a discourse analysis perspective. Talk is discursively organized, it's morally imbued, and bolstered using a variety of discursive techniques. Right. So it's really interesting when we hear paramedics describing how they came to the decision to become a medic.
So another theme that has emerged from the data is a disjuncture between what counts in formal education of paramedics and what's really important to the paramedics themselves in the groundwork on the streets. So in formal education, the focus is on theoretical knowledge and standardized ways of knowing. Competencies must be met according to a checklist. Students must show they can, tick the boxes and demonstrate their knowledge in very contrived settings. Whereas in the everyday work on the streets, paramedics find that what counts differs from this focus. They speak of the importance of soft skills and the social interfacing work they do with patients. They talk about learning to do things the street way versus the school way. They also talk about the need to address things like the social determinants of health, mental health of both paramedics and patients, and the high risk for burnout. So there's a disconnect kind of here between what counts in education versus what counts for paramedics in their work on the streets.
And when we think about soft skills, there's really nothing soft about those skills. They really actually save lives. but it's interesting to hear what is focused on in the formal education versus what's focused on in practicums and in practice. And so this metaphor of having to wear different hats is sort of emerging in this data, right? A commonality among several paramedic students we've interviewed is this feeling of what counts as a good paramedic differs between contexts. They must wear several different and oftentimes conflicting hats, so to speak, in order to demonstrate competency, depending on the context in which they are asked to demonstrate such competency. And so we see here, for example, what counts as a good paramedic in schooling, such as like associated with writing an exam, differs from what counts as a good paramedic when you're on the streets tending to a patient. And their criteria for determining this notion of what counts is highly organized by a variety of key documents that outline competencies, good student, and of course, good potential worker as well. And so paramedics must don different hats to perform as a good paramedic according to these varying expectations placed upon them.
All right, so this slide illustrates some of the tensions that we've seen in the data when it comes to paramedics and their education. So standardized ways of knowing. So the focus on competency checklists rather than the complex and contextual work paramedics actually do on the streets. Another thing we've noted is not just burnout from the job, but burnout on entry to the field due to the training. Especially in BC, the primary care paramedic program is 8 months instead of the 2 years it's on other provinces. So you see paramedics entering their work already burnt out from this training. The education not being student-centered, so treating students as objects to be kind of churned through an educational program, rather as their future important roles as paramedics. And also, that same idea as education as a business. So a lot of the institutions seems to have a financial rather than an academic focus. A very big theme and tension is, students saying that they feel unprepared for the field once they enter their work. So students don't feel ready to run a call when they graduate, even though they've met all the competency checklists. They don't actually feel ready to do their jobs. Another thing is, doing things like we said, the street way versus the school way. So how to run and call in theory, how the school teaches you to do it versus in practice, how paramedics learn, from other paramedics on the job or just, by themselves on the job. There's a street way to do it. And then finally, what we already kind of touched on, what makes a good medic. So this really differs according to different institutions, to the schools, to licensing programs, to employers, BC Ambulance, and also to patients and to medics themselves. A lot of varying definitions of what it actually means to be a good paramedic there.
Thank you. Excuse me. And so here we just have a few quotes that exemplify some of the, some of these tensions, some of these themes that are emerging, this notion of, learning how to be a medic through deploying a certain algorithms versus the street medicine work, the contextual work, the non-standard work of responding to your complexity of patient and scene. The learning of, for example, this notion of bad, quote unquote, bad habits, right? We see the emergence of bad habits as being constructed depending on the context. What's a bad habit in school perhaps is one of those habits that makes running a call, smooth and functional, if you will. And so these quotes are really exemplifying some of this theory practice divide and really drawing attention to a variety of different tensions that we're noticing, disjunctures and tensions and what we call lines of fault, whereby we're seeing, education on the one hand being geared towards certain things, and we're seeing, the impact they're having on students, right? So this theme of a good student versus a good paramedic and how what counts as a good student doesn't necessarily lead to a good paramedic, to me represents this sort of this line of fault in EMS education that requires further explanation. And of course, that's where our research is situated within. Right, learning how to practice on the streets versus learning what's taught in school, and then learning ways of demonstrating your competency depending on context carries with it a lot of work and work processes that carry significant tensions for paramedic students. And so what? When we think about the so what, right? Why is this relevant? In this research, we are problematizing the education and training of paramedics in Canada. We're exploring EMS education and training and how it's socially organized. Uh, we're asking this sort of like, how is EMS, this question, how is EMS education in Canada organized and who benefits from this social organization? So we are exploring the benefits and who does not benefit when EMS education is organized based on this very standardized, competency-based way of knowing and doing education. And so we argue that IE can be used as an alternative lens to not only explore health professions education, but really trying to make health professions education more generous based on the experiences of students and the actual work of being a competent paramedic versus competency in text-mediated ways. So thank you very much, everyone. We look forward to any questions you might have following the other presenters.
Great, thank you.